Hi, this is Philip Ador, founder of NCLEX Iron 45-Day Challenge. In this video, I'm going to be talking about bone fractures. So bones are usually healthy and strong, and they sustain us with movements, etc. However, due to some form of trauma, vitamin A deficiency, low bone density, or being old, bone fractures can occur. Bone fractures can lead to tears and blood vessels, which carry nutrients to the bones, which will cause some problems. Bottom body obviously has some mechanisms to repair bone fractures. The bone fractures itself can be categorized into 4 parts, classified by the positions of the bones after fractures. Can be classified of the completeness of the fractures, the orientations of the break, or whether the bone ends to penetrate the skin. So positions of the bone heads can be classified into 2 types. In non-displaced, the bone's positions do not move. However, in the displaced, as you can see by the diagram, you can see that the bones move, and this is a displaced. Because the bones are displaced after the fractures, the completeness of the break essentially means whether the bone is completely fractured or incompletely fractured. So whether it incompletely doesn't break off or it completely breaks off. Now, the orientations of the break. What it means is that whether the fracture is on the vertical axis or the horizontal axis, also known as the linear transverse. Penetrations of the skin is obvious. A fracture that penetrates the skin will cause a compound fracture. And one that does not penetrate the skin will cause a simple fracture. Okay? Let's just learn more about bone fractures. Let's just say that a kid fell down and broke his fibula or tibia, for example. So now what happens to the bones? Let's zoom into the bone and learn how the fractures repairs itself. So here is a bone, typically a long bone. Contains the periosteums which wraps around the bone. This is the fracture. We have the compact bone and the hollow tube, which is the mother compact bone, and also we have the spongy bone. We have blood vessels here, and blood is full and accumulates in the body. However, few seconds, minutes after the fractions, we have a major swelling. Here's a fracture again. On this stage is known as the hematoma stage, or where the hematoma formations begins, and essentially the hematoma formations with blood accumulates, forming the hematoma, and this causes a death of some cells and swelling and pain associated with the area. As you can see, the vessels are damaged here. After a few days, the bone will go to the second stage, known as the fibrocartilaginous stage. So the blood vessels here are regrowing, the new blood vessels forming. From granulated tissues forms the callus. And also, outside of the fractures were the periosteums. So the granulation tissues fills in the gap with the fractures and rejoins the fractures that fractured bones together, and this is what the subcarious essentially does. Then after a few weeks, the fractured bone will enter the third stage, which was bony callus formation stage. Now this stage, the bony callus formation stage, is when the soft callus previously formed will then become a bony callus. And we have a new blood vessels here. And here, now we have the bony callus, which is formed with the help of also other tissues in the area. So soft callus converts to bony callus in the stage. Then after several months, the bony callus will remodel to become the fine bone. So this is a bold bone remodeling stage where the bony callus is remodeled to become a strong new bone. So healing occurs and the compact bone is laid down, and most of the plastic activity also increased during the stage. So essentially the previously fractured bone is now completely healed. After the fourth stage, the hematoma stage, fibrocartilaginous callus stage, and the bony stage. And the last stage, which is the bony remodeling stage. Let's talk about osteomyelitis now, which is related to bone fractions. So what is osteomyelitis? Well, osteo means bones, myelitis means marrow. We'll see the relationship why. Osteomyelitis is a bacteria, specifically Staphylococcus strain, can infect the above during a bone fractures or through the bloodstream, and once the bone has been affected, the person starts feeling severe pain, sweating, it also swelling of the injured side. And what this bacteria usually infects are the long bones. The ends of the long bones and the end of the long bones, the bacteria will cause the necrosis of the bone cells. So the bone cells begin to die there. Also, pus being formed, and essentially this previously strong bone will become weak. Not only that, if this condition is not treated as soon as possible, osteomyelitis can become chronic and a lot of bone cells can begin to die. And this can have serious consequences. And the cause of the osteomyelitis, as mentioned, is Staphylococcus, but particularly this type is Staphylococcus aureus. So once this bone has been infected, there are some serious changes. The first of all is the pus can be formed by the infected area because of the immune cells, trying to neutralize this problem. So pus formations, and it moves out of the cavity and pushes the peritoneum out. And essentially after a while, what this would do is that the new bone formations could possibly occur because the bone cells around the area will think that the body wants to create a bone. But essentially osteomyelitis actually causes boning death, specifically at the end of the long bones, and that is why the osteomyelitis are a very serious condition.